couldn't save it. I'm turning off the news, 'cause I don't believe it. I'm fixing things.
Well, hello, everybody.
I'm fixing things.
Hank Linderman here on Thursday, September 24th. In the strangest year of all of our lives, I think.
I'm clearing out my old clothes.
Yes. Chris Pritchard's here. He's already shared. So he gets to hear that. And he also wants to hear the Gregg Adams jingle. Here you go. You ready? Here it comes.
Gregg Adams, good Dr. Adams, ask Dr. Gregg.
Absolutely. Thank you, Randall Kirsch. We've got a request, by the way. John Winkleman wants a theme for the next time he's on. I'm thinking it needs to be a blues. I got the single payer blues. Anyway, Mark Andes is here, my dear friend from Texas. Barbara Tichy is here. Bill McNichol is here, and all of you are sharing. I'm really glad to see you all. This is not going to be a fun day, I don't believe. We're going to be talking about some serious things, and the subject that Dr. Gregg wanted to speak about is healthcare worker burnout, and I think that applies to a lot of us are going through burnout, but I can only imagine what that is like for someone who works in healthcare. Well, anyway, it is time for us to do our numbers. Let's get that going first. And of course, as we know it always does, took a little longer this week, but the numbers popped right back. Look at that, 1,112 new deaths. Tragically, 41,000 new cases in the United States. Have a look at India, 89,668 new cases. They've got a chance of catching us. They've got quite a ways to go, but they're within spitting difference. Cindy Braun is here. John Alma Barnett is here. They're going to help share. And we're going to have a special guest tomorrow, by the way, but remind me if I don't tell you about it. I'm going to keep that in suspense. Let's look at, this is California, Texas, Florida. We've been watching them. We've been watching these top three states, even though New York has had many more total deaths. The most amount of cases currently is California, but look how close Texas is, and look how Texas is adding more new cases than California. So Texas may move into number one here pretty soon. So that's not a good thing. All of these states need to do better. You can see at the very top, there's Kentucky. And Kentucky is hanging in there, doing a good job. Thank you, Governor Andy. I want you to look down a bit lower to North Dakota, a much smaller state. And they have, and the number I want you to look at is total cases per million. So you see the red line, and then to the right of that, which is new deaths, the red line is new deaths. Then total recovered active cases, total cases per million. Kentucky's at 14,000 cases per million. North Dakota's at 24,000 cases per million. Let's go back and look at the USA. USA is 21,000, so that's interesting that they're hitting that further. South Dakota, Cindy Braun is here, and she says that South Dakota just had 445 new cases yesterday, which is their record. So anyway, Roy Frazier is here all the way from the United Kingdom. Glad to have you here, Roy. Roy, you working on your video that we can use for the fundraiser, for the virtual fundraisers? Those start this weekend. Barbara says we had a city bus driver die from COVID here in Richmond yesterday. So this thing is carrying on and carrying on. Let's have a quick look at this. So this is again from Johns Hopkins. Notice again, this is all part of one wave. You know, way back in April is when it really started to take off. And look, it never got back down to zero. And then it jumped up. So this is cases, new confirmed cases by day, and we are starting a third wave within the first wave. This is very, very dangerous, and it's a terrible thing. Before we call Dr. Gregg, I want to read something. This is something that someone emailed to me, someone close to me. I'm not going to identify them. They can identify themselves if they want. But this was sent out, and it's regarding Breonna Taylor. Before I say that, I'm going to point out that our guest on Friday, tomorrow, I'm going to show you his picture. That's Pastor John Lee from Mount Zion Baptist in Bowling Green, Kentucky. He's going to speak with us, and I'm sure he's going to be talking about the verdict that came down yesterday or the day before. So anyway, I'm going to read this, and then we'll call Dr. Gregg. So this is in response to what's going on in Kentucky, and this was part of an email chain that I was part of, and this person responded. It starts by referring to our Attorney General, Daniel Cameron. Respectfully, Cameron is a shill. He didn't mention in his press conference that 12 neighbors did not hear any announcement that the people knocking down the door were police. The one witness who said he did hear the police identify themselves took 3 under oath interviews to say that he heard the police identify themselves. He was the upstairs neighbor, stuck his head out the window when he heard the activity outside and was told to go back inside. The first 2 interviews, he said he did not hear any announcement. Sadly, Kentucky is an everyone can have a gun state, and they are a stand your ground state. Breonna Taylor's boyfriend was completely within his rights to shoot at whomever he thought was breaking down the door. His sworn statement was that he thought it was Breonna's ex, who was in fact a drug dealer, who was breaking down the door. The warrant was one of 5. The suspect was a male. The suspect on the warrant had already been arrested before they exercised the no-knock warrant at Breonna Taylor's home. When the police entered the house and saw that the person on the floor bleeding out was a female, they did nothing. They offered 0 help to her. She suffered for about 5.5 minutes before she died. Walker, the boyfriend, was the person who called 911 when the whole thing began. They arrived 20 minutes later. Hankinson blindly shot into the apartment and also blindly shot into the apartment next door. An exhaustive search of her home afterwards showed no drugs, no big stores of cash. Her home's in a neighborhood that a huge local developer has been working to gentrify. It was gross when Cameron made his speech about justice. It was worse when the president quoted him and called him a star. Cameron was on the short list for Supreme Court of the United States consideration. In my opinion, Cameron is who gave the distorted representation of the verdict. I don't condone rioting and looting. That said, 60 years of peaceful protests have not gotten anyone's attention. Colin Kaepernick said it best when he first took a knee. Quote, police get paid leave for killing black people, end quote. This area of Louisville is next to where I grew up. I worked in the area as a checker at Winn-Dixie when I was 16 years old. My apologies if I offend anyone. I'm sensitive about the rampant, unending racism in my hometown. It's not surprising that the city settled for $12.5 million with Breonna Taylor's family. Her killing was covered up for months. Also, and MSNBC was over the top in their coverage. Michael Steele repeated the saying that, quote, any prosecutor can indict a ham sandwich, end quote. Apparently not if the ham sandwich is on white bread with a badge. So, as I say, that comes from an email that was sent to me. I think it's time to call Dr. Gregg and see if we can get him. Oh, hang on. Well, here we go. We've got Dr. Gregg coming, I hope.
Gregg Adams, good Dr. Adams, ask Dr. Gregg.
Dr. Gregg, are you
Good
there?
afternoon.
How are you, Dr. Gregg? Dangerous question.
I'm doing okay.
You know, we haven't heard from you in a while, and I suspect it's because you were pretty tied up.
Yes, the clinical responsibilities that I have wax and wane a little bit, and sometimes they become a little bit more to the forefront. We also, in our division of 11 general surgeons who do trauma and general surgery, have had 2 of them go to other facilities, part of our same greater enterprise, but it's put more of a weight on the people who have been left behind.
including you.
including me.
Yeah. Well, first of all, are you okay? Are you taking care of yourself? I mean, are you taking measures to counter what you're dealing with?
So yes, there are lots of things that you can do. One of the things that I've worked on with the people that I work with is just those very things. It's and I'll talk a little bit about the article that you put forward, talking about the true epidemic of burnout amongst physicians. And one of the things that I think that people need to have is a means by which to refill their soul.
Yes.
Because, and I don't mean that in a religious or an overly spiritual way. I mean that what you do as a physician, and what many people do as statesmen, as people who deal with the public, they put a little bit of their humanity out, and it can deplete portions of their energy, portions of their happiness, portions of their soul, portions of their sense of well-being with mankind. And if you don't have something that refills your soul, then you don't stay safe in that job for very long. You become calloused, you don't allow people in, you don't reach out and try to make the experience that they're going through better. And so I added a question when I was interviewing people to take jobs where I work. I added the question, what do you do to refill your soul?
Yeah.
Which isn't on the normal interview questions. But I found that people were very ready with an answer. Oh, well, I paint. Oh, well, I exercise. Oh, you should see my dogs. And they would say what it was they did when they were refilling their soul. And I thought, oh, these are people who are safe to put into jobs where you can reasonably expect that there's going to be a toll on their psyche. And then if they said, oh, my joy is my work.
Oh.
Or I just don't have time anymore to exercise. I used to run, but I can't do it anymore. Or ever since the triplets were born, I don't have time to get to the gym. I don't don't sing anymore. I don't play the piano. I don't play the violin. And you see the things that they used to do fall away. And I wonder about their safety in the future in a job that really can empty their soul on some days.
Yeah. Yeah. What do you mind sharing the sort of things that you do? I mean, some of the things I know that you do are big, like the Black Rock Project.
Yes. Creating something that is lasting, a piece of art, an interaction, a friendship, is big in refilling my soul. I have I usually talk about coming home and playing the piano, usually singing at the top of my lungs. People say, oh, you play the piano. And I usually say, for no one's pleasure but my own. I watch movies and find myself and this is when you know you need to do something, is when Hallmark commercial brings tears to your eyes. And you realize, oh, I have to empty this compartment where I put all of this energy, all of these feelings that I hadn't been able to get rid of. And then you know it's time to play the piano or watch Casablanca for the 1500th time and cry at all of the places you usually cry. It helps get out the emotions so you can refill the soul.
Well, you've just kind of answered it because, yes, big things, but also small things. And you have a really unique approach to this and pragmatic approach. The idea that you've been putting off reacting emotionally to tragedy in your day-to-day work. Because you can't react that way, I would imagine, sometimes in your work.
No, there are times and in my job where I am managing a room that is all there to take care of one patient, someone who has been in an accident, has fallen a distance, has been hit by a car, has been the victim of assault. And I, as a trauma surgeon, have a wonderful, interactive, communicative team of nurses, of therapists, of residents, of people who are in and out technicians that help with vital signs and starting IVs and things of that sort. So there's a little bit of a team management component of it. And you're also dealing with a patient who's often quite scared, and the patient's family or friends who are equally scared. And then you add to that a component every once in a while. If a child is hit by a car, then you look around the room and you can see the nurses who have a child that age at home, because their faces are different. Their jaws are set. There's a determination in their eyes, because they are not just living the fear of that child, they're living the fear of their child at home. And that is an emotion that you have to manage as a team leader at the end of that experience with the patient. And you check in with them. You say, are you doing okay? Oh, I have a 5-year-old at home. And you say, wow, that must have been scary for you. And you debrief and you manage and you take care of all of those emotions, knowing that you're taking on some of those emotions and you're filling up a compartment that fills up with your own emotions, the emotions of the room, the emotions of the family, the emotions of the patients. And you can close that cabinet for a while, but at some point, when the Hallmark commercial comes on and you get weepy, you realize that compartment is full and you need to empty it out. Yeah. And that's what you do, something like that, to empty out the compartment. If you don't, then there's no room for any other emotions and you don't have time for them. You become calloused. So I teach my residents, and I teach the nurses that I work with, you have to empty your compartment every once in a while. And that is the things that refill your soul. Going for hikes, going to the gym, playing music, playing with your kids. I have 2 wonderful kids. I have a beautiful wife. I live in a part of the country where it's sunny a lot of the time. Happens to be on fire at the moment, but we have blue skies for the last couple of days, and it's been absolutely glorious. There's lots of things that I can do to bring my mood up, but you have to give yourself permission to do it. And that's where the problem comes with burnout. And the slide that you showed talked about physicians burning out because they have, worked hard with lots of challenges. And there is a word that we've used for too long that always sounds like it's blaming the physician. Oh, you didn't have enough resilience. Oh, well, you should have chosen a different job. Oh, well, you obviously, didn't plan this very well because you ran out of energy. It's like bonking halfway through the marathon in our minds.
Right.
So as we thought about it, we thought burnout may be not the right word. Huh. And so, and I'll explain a little bit later what words we use. The thing about burnout is it is amazingly common. If you ask any physician who has been practicing for 5 or more years whether or not they've ever felt burnt out, almost all of them at some point say yes.
And that's before a pandemic.
Correct. This is way before pandemic.
Right.
So the baseline is that between 40 and 50% of physicians that are actively practicing now, and I'm talking about all physicians, not just trauma surgeons, family practitioners, urologists, pathologists, psychiatrists, people who do physical medicine or rehabilitation, about 40 to 50% of those people are actively burned out. They are going through the motions. They are not spending the emotional energy that's necessary, I think, for a good patient-physician interaction, for a patient to trust their physician, to say, this is a human being who cares about what happens to me, which I think is an important exchange in a patient-physician relationship.
So
that's a lot of docs.
That's a lot of doctors, and that's, like we say, before the pandemic. And I'm also struck by your pragmatic approach to this. Was this taught to you in medical school, or did you come up with this? Were you part of a group that came up with this, separate, like on the job? Did you all discuss this and come up with it yourselves?
I don't ever remember being taught this when I went to medical school, but I went to medical school last millennium. It's becoming more and more common. The way that Stanford University, where I did my surgical residency, now manages it, is with a well-being retreat every year and well-being lectures every month. but it took the suicide death of one of the residents that trained with us before we finally went, oh, we are in crisis here.
That's
It
tragic.
shouldn't take that loss.
Oh, well, and we're also at a point, I made a comment to someone 2 years ago. It's stressful being a candidate. And the person looked at me and said, it's stressful being a voter. It's stressful being a citizen. And that certainly applies this year. So there's certainly a lot of this. So even though we're speaking about it in terms of healthcare workers, there's a lot of us that are going to benefit from what you're saying.
Well, and this is where it's important to know that burnout is the wrong word.
Right.
The word that we use, the words we use, is moral injury. And the things that we are learning in healthcare and about physicians feeling this injury is applicable to anyone who is feeling stressed now. Moral injury means that the things that are happening to you at work when it comes to physicians, or during the day, or reading the news, or hearing a neighbor talk, it affects your moral fiber. I don't want to live my life that way. And yet it seems like there's pressure to live your life a way that you don't want to live it. In medicine, people who run hospitals and healthcare systems learned all of their knowledge from other businesses and not from other medical communities. Applying a business model to medicine is something that is anathematized out of the thinking of what the physicians want to do. I want to take care of every patient for as long as that patient needs me to take care of them. The administration who says, we have a bunch of people who pay for your care, so you need to see them at 15-minute intervals.
Right.
Anyone listening knows that there are some days when 10 minutes is fine, but some days you need 20 minutes. And if I looked at a 15-minute slot where I knew I had to describe a diagnosis of breast cancer to a young woman and all of the treatment options, I knew that the rest of my patients are going to be mad at me because I'm running very late. Because I would take as much time as I could until all her questions were answered, until she knew that she was in caring, capable hands before I went on to the next patient. But it means that your customer satisfaction scores are going down, Dr. Adams. You seem to be late to all of your appointments.
And someone else looks at you and says, you really could be getting more patients through here if you would just not talk so much with the patients.
Correct. You as a candidate may feel the same thing. If you're looking at a population of people, you want to go and shake some hands and answer some questions, and there are good questions being asked, and 3 people down, they're waiting for you to move on, but you are trying to answer all the questions that you can with the person in front of you.
Yeah. It
is a frustrating thing because their expectations and your capabilities don't always match. Yes. And you may feel like it's an injury. Injury is a word that's very familiar to physicians. It's a new word for people who are thinking, why am I mad at my television set? You just got told something that injures your morals. And so the same tools that I just described, recognizing when your compartment to deal with this stuff is full, giving yourself permission to say, it's time to empty this compartment, finding something that you can do to let your emotions flow, even though it may not be attached to what you're crying at or yelling at. And then forgiving yourself for having that need, because we all have that need.
How much of this is related to what I think my mom used to call the Protestant work ethic? In other words, the idea of pushing yourself and, pushing yourself to achieve and work. And I mean, I can think of Episcopalian hymns that celebrate work.
Well, I think that you could blame the Protestants for that, but I think that there's lots of people who feel that your work ethic, an individual's work ethic, is what they have. If there's adequate reward for the work put in, you would find that everyone's work ethic could actually improve. if you felt like you were appreciated, that the work that you were doing was meaningful and that people benefited and that you got appropriate praise and appropriate direction and appropriate education, you may find that work ethic is actually like a muscle. Appropriately exercised, it could grow.
Yes, that's certainly true. And there definitely comes a point where all of us push past good sense. You know, we push too far, and there's always a price to be paid.
Yes.
Yeah. Do you mind if I ask you a question that's unrelated to this? If you want, we can come back to this, but we have a question from someone asking about any recent news about vaccines that you might have heard related to the virus.
Yes, so there are vaccines in process. The process is a long process. I think I told you last time that the fastest we've ever developed a vaccine was the mumps vaccine, and it took 4 years to develop.
Right.
And everything else has taken 5 or more years.
Wow.
Part of that is because of the care taken by the FDA to make sure that the vaccine was safe and that it was effective. There is no 100% effective vaccine. Every vaccine it has a population of people that don't develop the antibodies or don't respond to it. And so you want to have as much activity, as much ability to make antibodies without causing harm to a population. Populations are very variable. Some people are allergic to the media, the egg that it's grown on, or
Right.
some people are allergic to the preservative, and people will have idiosyncratic reactions. One of the things that has been studied recently, the study was stopped by a major pharmaceutical company because of one patient had a process where their spinal column was losing its protective coating, which is not something that anyone ever wants to have happen. And you certainly don't want to have that happen because of a vaccine that you're giving someone so that you can avoid an upper respiratory infection.
Right.
And so we have to be careful. The fact that President Trump desires to have a vaccine readily available the day before the election is beautiful, wishful thinking and really dangerous if he tries to implement it, because we are nowhere near a safe and effective vaccine. Nowhere near. We're going to have this virus or a form of it for the next several years. It's not going to be as bad as this year. Just like the flu has good years and bad years. The next SARS that comes through, we will have enough people who have had it or will have shared some sort of immunity to it that it's not going to be as bad as we've seen this year. This year was a remarkably bad year. It happens about once every 100 years. But we're not going to have a vaccine that really works for another 4 or 5 years.
Wow.
We'll have something, but we will not have it well vetted until we know exactly what happens to a population when they take it.
So it's going to be quite some time before any of us should feel safe taking a vaccine. It sounds like what you're saying.
Yes, and it's not that we're not more clever. We are. We have computer models. We have the capability of anticipating which types of vaccines will work faster, and we're really good at growing a lot of drugs really quickly. That's not the problem. The problem is finding out what happens when you put that drug into 10,000 people.
Right.
And that's the part that is always the most harrowing part of a drug study. There was a very famous drug, and I won't give you the name of the drug, but I guess I can. That's off the market now. It's called Trovan, Trovan. It was an antibiotic. It was like ciprofloxacin. And it was designed by computer. It was one of the more sort of amazing wonder drugs. The FDA thought it was fabulous. It normally, when you have a drug and the FDA approves it, it will approve it for 1 or 2 indications: urinary tract infections, a soft tissue, a skin infection. Trovan came out of the gates with 7 FDA-approved indications.
Wow.
Everyone used it. And this was at a time, and no one can be proud about it, when pharmaceutical companies made it very attractive for physicians to use it. So some physicians were paid. Some physicians went on junket trips. Some people got laboratory components funded. Within a year, people started dying of liver failure
Oh,
with this drug. They had to take it off the market. And it was because they didn't have enough experience with it yet. And people died.
when
And
was this?
This was in the probably mid-90s.
Right. And of course, I grew up, the thalidomide was a drug that was released and caused all sorts of birth defects in the 60s.
Right, and I remember that. And it was, it's a reminder of the fact that the human body is so unknowable and can respond in things in ways that you don't even imagine what it's going to look like. You sent me an article, Hank, about that UCSF llama antibody that you and I had talked about. And someone passed it by me, and I said, "This is cool, except it's all been done in the petri dish and in mice.
Right.
No human being has seen it yet, and we're going to find out what happens when human beings see it, and we're going to find out that the human body is going to react in a way that we didn't anticipate because we built the Titanic, and we still have brains that do that. We have hubris, we have magical thinking, and then man plans and God laughs. And unfortunately, people die."
You know, I don't know if you're aware, but South Vietnam, or Vietnam did a spectacular job of dealing with COVID early on, and they have smacked it down again. They've done the thing that they do, which is they aggressively separate people. I even saw pictures from, I guess they're beer halls where you can go in and have dinner and drink beer and hang out with your friends. And they've put out plexiglass shields at face level between customers. They've left an open spot so you can reach over and get the snack that you're sharing, but your faces are separated by a plexiglass shield. They wear masks everywhere.
And it's good for larger droplets and things of that sort. And we're finding out about COVID so many things that are still more scary than we anticipated. One is that it can become aerosolized,
Right.
which means that it can hang in the air and be passed through the air. So when you are waiting for an elevator and as the doors open and the man who's standing in the elevator sneezes and then walks out, I'm taking the stairs.
Right. Yeah. Yeah. I hold my breath when I go past people when I have to go to the grocery store, and I'm wearing a mask and they are wearing a mask, but I still hold my breath when I go past them. But I'm amazed at the idea that South Vietnam can do this, but America can't. This is a political failure, I think, dealing with this. And, we had John Winkleman on, who we had a discussion with, and John is the one who studied single payer. He came back last week and basically said that there's no superiority to the type of medical system that you have. The inferiority of our system is politically related, that we're not able to get on the same page about wearing masks. We're not able to get on the same page about social distancing. We're not able to get all of the states to do the same thing at the same time. And so we remain 6 weeks away from knocking this thing down into being a dealable situation, which is just heartbreaking.
And always 6 weeks away. And American medical care has never been that exceptional, despite what everyone continues to say.
Right.
We have a higher infant mortality rate. We are horrible at managing prenatal care. We have made it difficult to access medical care, and so therefore it's difficult to deliver medical care. And part of it is political, but part of it is also industrial. It's the thing that Eisenhower warned us against, the trilateral commission, the government, military, industrial collusion, where it's not what is best for the patient, it's what's best for the pharmaceutical company, for the doctors, for the political agenda.
I think there's a journalist named Chris Hedges, who's can be extreme, but he calls it the primacy of profit.
Yeah, that's a great and horrible word for it.
Yes. So my wife Pam is asking, Can you please ask Dr. Gregg about using MMR vaccine to help prevent COVID? Something about the similarity between coronavirus and rubella. Have you heard anything about that?
I have not heard anything about that, but I will dig into it. Most of us have had the MMR vaccination. Usually you get it around 5 years of age.
Right.
It is one that we're finding does not last as long as we thought it did. So most adults have been recommended to go back and get a rubella booster. And so, yes, that may be a possibility.
And Pam is one of those that has had multiple rounds of pneumonia, and so she's exceptionally cautious, as she should be. She's, accepted the idea it would be very bad for her to get exposed to the coronavirus. So
I think it would be very, very bad for any of us to be exposed to the coronavirus.
that's certainly true.
Because the thought that, it's just a cold, you'll get over it, and 95% of the people do, we're finding out that there are gifts that this virus continues to give. The inflammation of the heart is one of the more striking things that we don't know yet what that means. We're looking at drugs to try and decrease inflammation of the heart, but we look at that inflammation, we see it turn into something like a Kawasaki's-like disease in kids, but we just don't know what it's going to look like in adults. We have no idea what it's going to do. GI problems continue. People are getting joint pains that continue. This is a virus that is much meaner than we think.
Roy Fraser, who is from the United Kingdom, is listening in, and he's asking about a drug that they're hearing about in the UK, and I'm going to have a very difficult time pronouncing this drug, so I'm going to spell it, and maybe it's one you've heard of. ACALABRUTINIB.
All right, I'm going to make you spell it one more time so I can write it down.
Okay. ACALABRUTINIB.
Right, so this is a monoclonal antibody. I have not heard of this particular one. There are probably 15 different monoclonal antibodies that they're using. And if they're using one in Great Britain now, tell him that I will look it up and I will give him a response on the comments.
That would be fantastic.
And like always, I'll go through the comments and I'll answer any of your questions if I can. Sometimes I have to say I don't know yet, and I'll find out by next week.
Well, you certainly go above and beyond, time and time again in your daily life, and then you come on here and help us out. So I really appreciate all that you're doing.
Well, you brought up something that hadn't occurred to me. I was thinking of talking about the moral injury that all physicians are feeling now, and it's as COVID comes back this winter, the frontline workers are all feeling this dread of a population that doesn't understand the seriousness of the virus, of a group of administrators who say, "Oh, you've had your PPE. How come you're not saving your masks?" But you reminded me that we are all feeling this moral injury, and the techniques that we can use as physicians, you can use as non-physicians to address it. I think that really is the take-home message. If you're feeling bad, you're feeling sad, it may be because you haven't emptied out that compartment. Time to empty out that compartment. It's not a panacea, but it makes it possible for you to maintain your humanity going forward.
I personally definitely get to the point where I realize I can either continue pushing forward and then fall down later, or I have to tell myself, you have to stop. You have to stop for long enough to recover some sort of balance. And that's when I go for a walk, or that's when I go out on the water, or that's when I pick up a guitar, or that's when I watch a movie. Same sort of things that you're talking about.
You show us your currency when you show us a picture of the view out the back of your house, and you see that beautiful river.
It is so peaceful.
That is one of the things that you use to refill your soul, and I think it's a great example.
Yeah. Well, Dr. Gregg, thank you so much for all your time that you're sharing with us. We really appreciate it.
That's my pleasure. This is a marathon. You can't do it all at once. You can't run as fast as you can and use all your energy. We want to maintain the good things about America, we're going to have to do it each as individuals, and you have to take care of yourself as well as take care of each other. Be good to each other.
Yes. Yes, sir. Thank you so much. And I hope you'll be able to come back sometime. We really appreciate you.
Oh, it's my pleasure. Thank you very much.
All right. Have a great day.
Okay. Bye-bye.
Bye-bye. Well, that's Dr. Gregg Adams. And, he's a busy fella. And the idea that he's going to take his time and respond to some of your questions, I'm just blown away by that. So thank you all for being here. There's a quote from St. Augustine that I've seen recently, and this is now, I'm back to speaking about the circumstances that our nation is in, besides the issue of the coronavirus, besides the issue of the difficulties we're going through just financially making ends meet for a lot of us. And the incomprehensible lack of justice in Breonna Taylor's case. Anyway, St. Augustine said, hope has two beautiful daughters, anger and courage. And you need anger, you need to react with anger about things that need to be changed, that need to be different. And courage helps you stand up to be willing to be part of it. And let's all, again, use our anger to focus ourselves to do what needs to be done. And I don't have my piece of paper here. If you're in Kentucky, you've got basically a little bit more than a week and a half to register to vote. I checked my registration. I'm good to go. Please, by October 5th, go to Go Vote Kentucky, govoteky.com, and be sure that you are registered. I'm personally going to vote in person the soonest day that I can, which I believe is something like October 18th. Anyway, thank you all for being here. Tomorrow, before we do that, let me make sure I have you all covered on and understand the significance of this. Pastor Lee, who's going to be here tomorrow, is the pastor at Mount Zion Baptist, and he's a very, very powerful speaker. And I have heard him speak probably a dozen times, and each time it's inspiring, and I can't say enough about him. So he'll be with us tomorrow. I'm sure he'll be talking about the verdict or the results of the grand jury. And I really hope you all will be there. Also, this weekend, we're going to start doing virtual fundraising, and I'm already seeing some of the performances that we've gotten, and they are unbelievable. Any of you that are musicians that would like to help, please get in touch with me. You can send me a message on Facebook. You can also reach out at my email for the campaign, which is hank@hank4ky.com. So send me an email if you'd like to contribute a video. But I know Jerry Goodman from the Mahavishnu Orchestra will be there. I know that Mark Andes from Spirit will be there. I've gotten a video from John Edwards, and John was in the band Foreigner, and it's just amazing. Any of you that would like to be part of that. Also, one more thing. This is a time that there's work to be done for these campaigns, and I realize I'll start talking about this more. But on Tuesday, we're going to begin doing phone banking for my campaign. And if you'd like to be part of that, also reach out to me, hank@hank4ky.com. Phone banking we'll be doing for a couple of hours on Tuesday, late Tuesday afternoon, and we'd love to have your help. All right. Thank you all so much. We will see you tomorrow. Keep your chin up. Take care of yourselves. Watch a movie. Play some guitar. Anyway, thinking about you all. Love you all. See you then.